we're recording the session. I should let you all know. The issue of Maryland enacting this legislation to guarantee reproductive health rights for the uninsured, signed by Governor Moore, HB 930. And then we know that the ebb and flow on the politics of that make it challenging. And I was hoping to get a feel from Sharon, given all of her experience in the area, where she feels the reality of that is. So without further interruption.
Well, I have very good news on all of that. And the reality is that it will be a reality. And we're super happy about that. I'm not sure, just to go back when you said keeping politics out of this, this, of course, is all politics, if you will. I understand what you're saying, though, of course. Thank you, babe. My husband has cooked some white cod fish with some rice. And oh, my goodness, it's so good here.
Nice.
Yeah, yeah. So, so this is something that Reproductive Justice Maryland worked on, as well as National Organization of Women. There was our own lobbyist and our friend Robin Elliott with Public Policy Partners, who is a phenomenal policy individual. She's also a friend, but all of the legislation in this state that goes to protect women and reproductive rights, either from parental leave all the way to midwives and nursing licensing and all of that kind of stuff, pretty much Robin has done that. When I speak to women and I say, you know, when you are safe in Maryland, it is because of Robin Elliott and Ariana Kelly to a large extent, and some other lawmakers, but it's Robin, comes out of Robin's brain. She's always thinking about 2 or 3 steps ahead.
Sharon, can you remind us of their elected positions?
Well, Robin Elliott is a lobbyist and she owns Public Policy Partners. Ariana Kelly had been a delegate in the House for 13 years. She went over to the Senate side for 1 year, and then she was appointed by the governor to be the executive director of Maryland Commission for Women. So that's the history of those two, and both those women have turned out to be very, very good friends to me personally, and then also to Reproductive Justice Maryland. Just as an aside, I founded and deputy director of RJM. We just celebrated our 2-year anniversary this past May, and it's unbelievable what we have accomplished just in 2 years. And people keep asking, well, where do you guys get your money? And are you all paid? And we laugh hysterically because no, we're not paid. And we have like $7,000 in our account right now, and that's it. So it's astounding what we've accomplished. And to that, I say, well, think what we could do if we actually had money, right?
Yeah. Okay. And now, can you give us a framing of what you see coming down the line in terms of, you know, maintain? It's a grant, right? So
let me back up because let me back way up because this is not a typical kind of grant thing. So Affordable Care Act, Obamacare, 15, 16 years ago when it was passed, one of the little, as Republicans called it, the poison pill, was that it required that $1 of every premium paid in ACA, in Obamacare, went to abortion care. Couldn't go to anything else. It had to go to abortion care. So that's $1 of every premium paid since that law went into effect. I think it's been 15, 16 years, something like that, maybe even more. Maryland has had in a security exchange account, if you will, $25 million sitting there untouched just for abortion care. People like Robin and Ariana and others have been trying to get their hands on that for quite some time to get it released. I don't think it was going to be helpful under or available to us, or hopeful that we could get it under 8 years of Hogan, of course. And of course, he has his own people at the Department of Health and stuff like that. So we passed a law this past session to release those funds. Right now, there is a commission within the Department of Health, which has already had quite a bit of upheaval, if you know, Ellie. And then by October 1, there's supposed to be a plan of how organizations apply for these monies. Let me talk about the organizations for a moment. RJM will not be getting any of those because we don't do abortion care. Planned Parenthood would be one of those. Baltimore Abortion Fund, and I'm going to talk about them in a second. The Cumberland Women's Clinic, Partners in Care for Women, which is in Bethesda, and there's a couple other of abortion clinics, that we have in Maryland. So a Baltimore abortion fund, let me give you an example. So when North and South Carolina banned abortion, or essentially banned it, and West Virginia did, so if you're a woman and you live in the southeast portion of the United States, the closest states for abortion care is going to be Maryland and New Mexico. That's it. Okay. That's the closest states, not the only state, but the closest states. So what that means in the overall map of the country is that there's about 25 million plus women who do not have adequate access to medical miscarriage management. And Ellie, you know how important that is, and you know how quickly women bleed out from miscarriages, right? So a lot of times if you're bleeding out, you don't have time to go to New Mexico, drive 12 hours, or Maryland, or whatever it is. So many people, it's just clearly unsafe to be pregnant in many of the red states at this point. And Arkansas and Oklahoma, and I can't remember the other ones, but there's several others who don't even have exceptions for the life of the mother. So rape, incest, life of the mother has always been the three kind of dogmas. There's always been an exception, even for, pro-life people, but they don't even have that now. There's no exception for life of the mother. So just as a sidebar, if you know anybody pregnant, they should not be going through a red state. I don't even want them driving through a red state, because if they get pulled over, they get in a wreck or anything, and they get hurt, they will let them die. I just say this very plainly as I can. Okay.
We have numbers on that, by the way. Do we have any sort of?
Probably Guttmacher Institute probably has some by now. Texas doesn't release these numbers, obviously, and the red states don't like to release them. But we do know that the maternal mortality rates in Texas since Roe v. Wade was reversed have gone up 33%. We do know that. So 33% more women have died from being pregnant or birthing in Texas since Roe v. Wade was reversed. It's disgusting. It's murder, in my opinion. So back to Baltimore Abortion Fund. Given the landscape, right, we have at least a 50% increase in abortion care coming to the state. This means a couple of things. It means that women get here later in gestation, okay? That means the procedure is more expensive, plus more painful, more emotional, all of that. We are also one of the few states that has a later in pregnancy termination. So before everybody gets up in, arms about that, there's no such thing as late term abortion. There's just no such thing. We don't do that. Late term gestationally is considered 41 weeks and beyond. We don't do abortions at 41 weeks. That would be infanticide. When we talk about later in term pregnancy, we're talking about those that are past the 24, 25, 26 week. They're usually unviable pregnancies. There's usually some genetic anomaly. There's somebody who's been diagnosed with cancer. They've got to go through chemo. It is the worst day of this person's life. And now they have to go make a decision and get a very painful procedure because of this. But very few doctors and very few clinics deal with these later in term pregnancy terminations. So back to Baltimore Abortion Fund. They exist solely to help women pay their copay if they have a copay, pay their bus ticket to get to Maryland, pay their overnight, maybe give them some money if they're working 2 or 3 jobs and a single mom, pay for the procedure if possible. So Baltimore Abortion Fund, they'll do a fundraiser and make $40,000 and then immediately spend the $40,000, right?
So to be clear, if you show, and by the way, this has been my experience and practice here, regardless of any individual's particular politics, you show up to an ER in the state of Maryland, you get the care you need, and folks respond to emergencies. I've been doing it for years, working here at various. More recently, University of Maryland. But the fund is actually accessible to folks from outside of the state.
Yeah, if people are coming from outside to Maryland, yes, this will help this. So Baltimore Abortion Fund helps not only Marylanders, but anybody else coming into the state. That's actually one of the arguments that Republicans made, because, and of course they created this whole shit show, right? This is why people have to come from North and South Carolina to Maryland, because of what they've done in those states. So here they're acting all self-righteous. Well, are we going to be paying for people out of state? Well, yes, because you did this,
And then in terms of our state and our communities here, what do you think the challenge, how's the challenge changed over the last couple of years with and with the recent federal legislation?
So we are going to be working on some anti-criminalization bills and language next year. Basically, anything a red state does or comes up with, we have to look at what we have and we have to see, do we need to close any loopholes? Do we need to wrap any loose ends up? So we currently have a woman right now in Maryland that was convicted of murdering her stillborn. We claim it was stillborn. They're saying, the prosecutors, that it was alive. It wasn't. But anyway, 33 years. Her attorney was able to get a new trial, and so she goes to trial next spring. She's fortunately out, but this is in Maryland.
So a point of clarification, the attorneys bringing this case are state's attorneys?
Yes, they are. It's Howard County, and they're liberal Democrat women who are prosecuting this woman. It is really something. We have a whole webinar on it. In fact, Ellie, I'll send that to you. You would appreciate seeing this. There's a lot more to that, and I don't want to go down the rabbit hole too much on this, but I'm just saying the criminalization is here. And there's a woman in South Carolina, African-American woman, of course, because this is who is disproportionately impacted by this stuff, right? Now, the woman here in Maryland is white, but of course, poor and unable to hardly have any kind of representation, all that. But there was a woman who miscarried in a restaurant in South Carolina, and they are charging her with abuse of a corpse. She miscarried in the toilet, which is typically where most people do. So anyway, I'm just letting people know that there's creative ways that the GOP is going after women. And every time they get creative on something, we have to look in Maryland to see what do we need to shore up.
Well, thanks for sounding that alarm. I wonder, in terms of the expertise we have on the panel of folks that are here, if Kiana has any thoughts or experience with this that she could give her perspective on. Are you there, Kiana?
Hi, I'm here. Sorry, I had to find the mute button. I'm driving. Hi, everyone. This is very informational. Thank you so much. I just had one quick question about the last thing that you said. You said a woman miscarried in the toilet and they're charging her with murder. So
abuse of a corpse, yes, because there is no law. There is nothing that in any state that I don't know how to say this. And they're making shit up. They're trying to make shit up.
But I mean, I guess I'm just wondering why are they, if she just miscarried, if she purely miscarried, why are they charging her? They just need a reason to charge someone with something?
It's because they no, I mean, I don't need, that's just such a huge answer, but
it sounds like, Sharon, if I can editorialize a little bit, is you're saying these cases are coming up because there are convenient ways for conservative Republicans to push the agenda, and they're actually choosing fairly poor examples of folks taking liberal
approaches,
a liberal interpretation of the right to an abortion, when in fact it has nothing to do with an elective termination.
It has nothing to do. And it basically, Kiana, I'm not sure what your name was. I'm sorry.
It's Kiana.
Perfect. Good. It actually goes to fetal personhood. So this is what they're trying to do, is establish that upon a conception, that is a person. And so this is why they're doing all of these silly things across the states, because they want to keep pushing that and this is why they're going to redefine what an abortifacient is, and that birth control will become an abortifacient. So birth control is next, I assure you. Now, we've already passed some laws in Maryland back in 2016, thanks to Ariana Kelly, that will protect our right and access to birth control. One more thing. So I'm not sure currently how they're going to have people apply for these quote unquote grants, if you will. I'm not sure what the process is, but it won't be, you're required to do a 50-page proposal or something. We know what the needs are and we know who needs it. And also, Ellie, I just wanted to mention this, that we are having some issues with hospitals, and Senator Clarence Lamb, who's a physician as well, is really on this. But some of the hospitals, particularly the religious ones, they don't like to do later in care, the high risk pregnancies, particularly when they come into the state and they're further along. So there's been some real pushback on that. And then there's also been some pushback on doing the later in term pregnancy terminations in hospital settings. just because everybody's a little bit nervous. So we really need to do some work on that. I personally don't think a religious hospital should be able to deny care of any kind. I don't care what it is. If you cannot do your job as a physician, then don't be a hospital. Don't be a hospital. You know.
So now I've got to add this.
Mhm.
Clearly, there's a range of viewpoints
Mhm.
on the concept
Mhm.
of the right to abortion and
Mhm.
presented in our communities, regardless of economics and minoritization, which goes to religious beliefs.
Mhm.
And this is always going to be a challenge. The
Mhm.
fact that the rights to safety, though,
Right.
are part of the guarantees that the state is by law responsible to, is I think a point of pretty straightforward defense from the state's attorney. I'd expect the
Mhm.
exact opposite, in other words, from what you're sharing.
Mhm.
And so I find that quite disturbing. So please, let's share the information so that folks are aware that this is pretty disturbing trend that
Yeah.
you're citing.
Oh, it's
Thank you.
terrifying, actually.
Yeah.
And I tell you what, Ellie, that Clarence Lamb would be a good addition to this call sometime. He's extremely knowledgeable. He actually still practices medicine like 1 or 2 days a week, even during sessions. So he's a general practitioner, I believe. But he does a lot on this issue with the hospitals, and this has been a beef of his for quite a while. So just
Well,
FYI, that might be, he's great guy too.
well, thank you for that advisement and that information. And now I'd like to change speeds a little bit and go to another area where we seem to be more than a bit lacking. And I find it extremely concerning. And I'm doing a lot of work in this area. I'll share that at the end if we have time. But and that I invited my friend Mr. Thornell Jones to join us to give some sense of part of the reason for that frustration being that there aren't enough of folks that look like us providing care. But I want to throw it over to Reverend Watts from the Kingdom Life Apostolic Church up in Brooklyn, Maryland, in North County. And if he can speak to the challenges that are ongoing for men, mostly, I would say, the more acutely distressful thing is often younger men dying prematurely and not having access to care. But I pulled up a concerning piece of legislation, SB 243, that was presented this year, was proposed to repeal a law requiring the Office of Community Initiatives to even research the needs of Black males. And the fact that you can bring a law that says you should not study the matter of inequity and the lack of resources for Black men is extremely distressing and upsetting to me.
Can you repeat the number of the law, please?
It's called SB 243.
Thank you.
And again, the point being that friends and I have, and I'm a Black physician, but I'm not a primary caretaker. I do roles in urgent care and I do roles in the emergency department, which sometimes are thought of as primary care by default, but they're not the primary role and function of that clinical role. And it's part of the reason that I'm spending more time in public health advocacy and these kinds of things rather than clinical work is this very, very intransigent situation where we don't have enough providers for folks at the primary care level, at the preventative care level. And then Thornell is going to throw a little bit of a background on his experience as an older man trying to get care here. But I want to start off with Reverend Watts. If you could say something about what you see as needs and things that are missing for Black men as you experience it.
As it relates to healthcare or health or mental health, one of the things is the misconception that I run across in education, because I am in education and I get to deal with Black and brown boys in the alt ed setting. Now, the alt ed setting, that's kids who don't go to the comprehensive schools. So the comprehensive schools are what we quote unquote the traditional schools or the regular schools. These kids get moved out of that setting and go into an alternative setting where where either for behavior or for something traumatic or just their cognitive ability. However, I think the concerning thing for me is what I've noticed is there is not enough work on Black and brown boys that deals with anxieties and trauma. Typically, when you talk about anxieties, there is a kind of model or what that looks like, what that appear to be, what even bullying. It looks very different to a kid that's being called names and nothing is done about it. But one of the things that I've dealt with at my school and kids in Baltimore City is anxieties. And I didn't know that's what it was, from being afraid of walking home at night, carrying a weapon because you're trying to get home safely, or you don't know what's going to happen. Staying up late at night and wait until the crack of dawn. This is a new one. Waiting till daylight to go to sleep because of past traumas of somebody running up in your house and taking you out. So in the night or whatever. So that was a new one that one kid shared. So, but another thing is that I've learned that Black boys and brown boys deal with trauma differently. And the anxieties are how we, and even how we deal with them. We sometimes deal with them differently as a culture. Just tell them, hey, suck it up. You be all right, pat them on the back, and we send them back into that place of their trauma.
Yeah.
You help them 7.5 hours, maybe 8, maybe 9, but at the max, you got to go home. And then you got to go right back into the stuff.
This is something we've been talking about for quite a while. And part of the problem is acculturation in a situation where you're told that that's what masculinity is survival. And whether or not you're scared, hurt, or vulnerable, those things are taken for granted that you are somehow beyond that. And we call each other on where our brainwashing is so involved in all of this process that we feel that if we don't, measure up in that way, and this has been going on obviously for, hundreds of years maybe, but the manifestation now and in my lifetime and Demetrius's lifetime, and I've been with him trying to do violent interruption and speaking to these young men. You might get 1 out of a dozen kids who even listens that there are alternatives, because at that point they're so far gone. They're just saying, well, if I don't man up, I can't walk down the street, and that's exactly how you end up in situations high risk. Like we had one young man get shot that we visited the family. He wasn't the primary target. He was just the wingman for his buddy.
I was just getting ready to tell.
And it just doesn't matter, man. You show up because they're basically, the folks around you and the culture that you're in is just telling you, you don't show up, then you don't count. when in fact you know you're taking a huge risk. And this boy damn near died not too long ago. But again,
But that's the part that I wanted to get to and talk about, because we had to tell the nurses and the doctor that this young man was innocent.
right.
Like he wasn't, he wasn't a gangbanger. He wasn't, and to even have to share that to get care
Right.
was a pushback for me. I was like, wait a minute, what am I saying? You know, why do I got to tell you that this guy he went out to smoke weed with his friends, just went out there to do that and come back home and was in the crossfire of somebody else.
Right.
And so, but a lot of young people smoke weed. That is nothing, you know, adults smoking weed. Come on, you got that place down in Annapolis. I see more adults going in there than teenagers. Okay. So we're not going to make that into, but this young man going into that setting and having to plead with the nurses how to care for because of their perceptions of what took place is very problematic for me.
Yeah, we need not get into all of the hypocrisy of where most of the money comes from for the big drugs anyway. But that aside, I've been arguing this my entire career. All folks need to be, all patients need to be treated with dignity, and it's a lot of the judgments that we, make are absolutely wrong. When folks are called out about that, they tend to be very resistant and dismissive. And I got to say that, you and I showing up to the hospital makes a difference, obviously, because of our, backgrounds or degrees. It shouldn't take that. Folks should be treated with dignity. Beyond that, though, there just aren't adequate resources, particularly for mental health. I think Sharon made a comment in chat.
Definitely for
This
Black
is
boys, like
yeah,
there's not a lot of study. There's not a lot of studies of even that, even as it relates to, like, we're just coming to the iceberg of with trauma and Black boys and brown boys. Even, and this is another thing that I want to bring out, which I hopefully that you all can help me, grief counseling in schools for kids that deal with violence or somebody being unalive. We expect these kids to come back to school after their best friend or family member have been unalived. And, grief counseling is different from just plain old counseling. And just, and these kids are walking around hurting and in pain. And
then if you internalize that pain and you then externalize it, that's just perpetuating the cycle, which is the point of your interrupting. And that post that I did on you the other day, it was very gratifying, man. I can't say enough. Like, we just had an impromptu meeting, one of these young boys that you were able to affect their lives in a positive way and get them off the street and get them out of the drug scene. And now he's over at the church helping me distribute food and take care of the grounds. I was just so gratified by meeting him. Such a kind heart, like so many of these young men, they actually have pretty regular mentalities. They're caught up in a space that just, it's what they experience, it's what they know and what they live, but has nothing to do with who they really are. Sharon, you got a thought?
Yeah, I was just going to comment, Pastor Watts, it probably won't shock you that when they do quote unquote medical research for women, they actually use men. So,
yeah. Yeah, that's a good point. That's exactly the same point with regard to minoritized communities, whether you're talking about Native American, Hispanic, or Black. And the other day, I had a patient who was a newly diagnosed sickle cell patient, and she's doing pretty poorly. And one of the young doctors that was training was asking me how many things, what are the things we can do? And I said, precious little. There's very few recourses for how to address this problem. And part of the reason is the same thing we're talking about. It's an understudied and under addressed concern.
Absolutely.
And before we run out of time, because this is going to keep us, this is a big conversation. I do want to add that it's the spectrum of people. We'll come back to you, man. It's a spectrum of ages, not just young folks. So I just wanted Thornell to get a moment to share some of his experiences and frustrations coming at it from a different perspective.
Thanks, you, Ellie. I have a lot to say about what you were talking about, Reverend Watts. But in terms of health care for adults, it's very difficult to find a doctor. Most of the doctors who are specialists have concierge services, so you have to pay a couple $1,000s first before you can get to see them. You can get to see them anytime you want to after you pay that, but how many people have that kind of money? And so almost all the service that a person gets is from a PA who's not a doctor. They have a lot of experience maybe, but they haven't gone through the total experience of medical practice. And around Annapolis, it's very difficult to find some specialists who have any time on their calendar for you. And so it may take months for you to get an appointment to see somebody. So if you live in Annapolis and you don't have transportation or time or whatever to go to Baltimore, where there's a few more hospitals, you're not going to find the kind of care that you should be getting here. It doesn't make any sense.
Yeah, and I share that frustration because, to be honest with you, I myself, as a physician, tried to find a primary care doc who's a Black doc that might have some sense of my particular experiences and deal with me in a more holistic way, and there just aren't any.
That's correct. There aren't any. There was a woman here who took care of women's health needs. Man, she didn't have any time to herself. She was working like crazy. Black woman. And she finally left. I'm not blaming her. What kind of life did she have? Because the lack of doctors. And by the way, that all has to do with the AMA. The AMA has never supported the increase in the Black doctors, and that's why there's an NMA. My sister was a doctor, so that's how I know all about this. It's terrible. The production of doctors in America is ridiculous. You get more doctors from Cuba than you get from the doctor development here in the U.S. It's crazy.
I feel your frustration. Part of the reason why I've been very vocal about this is that since the early 70s, we've had about 3% of all doctors in the country are Black, Black men, and maybe 4% of all doctors overall are Black. And the effort to correct that situation has not, as you say, hasn't really improved over time. Although I have to say that in the last couple of years, AMA, being one of the few exceptions, has tried to make some change there and taken strong positions where other organizations have not, and have stood with the National Medical Association, which, for those of you that don't know, is the medical association that has admitted all people with medical education in the United States, men, women, and regardless of background or religion, much like the NAACP. But that having been said, not enough has been done over time. It's going to be hard to correct it, especially when you have the pushback that a governmental tsunami, if you will, of anti-equity sentiment. So that's there. Part of the reason why I kind of sort of tongue-in-cheek presented, let's have a picnic for Black physicians. The NAACP should host a picnic for Black physicians in the county to introduce our community to the Black physicians. is the fact that I know that there's scant few. And yeah, I could say more about that, but let me, I really want to hear from all of you. So yeah, Reverend Watts, what do you got?
I'm sorry. And I'm going to be quiet because this is it. I think Black doctors are that's at the high end, and I know Thornell can talk about the history of the hospitals in our community and doctors. Period. I mean, and I don't think everybody know today because my mom and my grandmother they felt a certain way about going to hospitals and certain doctors. But one of the points I want to bring out is, and I think this have to be a conversation. My program has helped all boys. I mean, from Black, white, Jewish, because it's called Young Black Scholars Institute. If a kid wants to be a part or wants to be connected with me, it is. But that is my name, and I know what my call is. But I have, he's my son in the medical as it relates to the paramedics in the fire department and the horror stories that he tells me about what's being said about people in our community. That and I just want to say, and I'm talking about the horror stories so bad because he is not Black and he's not Hispanic, he's white. And the things and the tears and the prayers and what I have to continue to minister him why he's there and what he needs to do and how he needs to give care to people of color and how he needs to deal with his own coworkers. Even
This is a white paramedic who's appalled at what he's witnessing in the field. By the way, in full transparency, we don't have a limit on this thing here. You can tell us anything that
I'm just saying that it is a systemic.
Really?
So it is just don't start with the doctors. It goes from the fire department, from the paramedics, from how they even deal with you. How they even dealt with my mother, that sometimes their approach can be so cold and callous. And stone face, almost like they are militarized.
Yeah, honestly, part of the problem of cultural competence is you don't see yourself in the other person, you don't see their humanity. And that's part of the big frustration I have, is if folks don't look at it and say, that's a person. That's not a Black person, that's not an Indian person, that's not a Spanish, that is a human being. They've got an issue. Let's address it.
So I have to speak to that. I went sailing in Greece and I had an injury. And I went to the pharmacist because that's what people do there. And the pharmacist took care of me, no problem. We sailed off the next day and we came to a spot where I could go to the hospital for them to check me out. I went to the hospital. They took care of me just like I was a citizen there. And I went on my way. It didn't cost anything. In this nation, what we have done is make money such a big thing that if you don't have money, it doesn't matter whether you're poor or white, people don't want to do anything for you. Now, we concentrate on this because we're Black, but the truth of the matter is there's more poor white kids in our county than there are Black. And they are treated poorly, and hence they really hate Black kids because they think they're being treated poorly because Black kids are being treated well. They don't know.
It's a divide and conquer concept, and it's
that is correct.
Absolutely false.
That is correct. And one of the things that I just pick up on what you said earlier, Reverend Watts, is that Black kids hate themselves. And they fight. We have 6 Black kids we're working with this summer, okay? And getting them, even the brothers fighting each other. And we went to pick up one kid one day, and his mother said, Well, he didn't go to bed till 4 o'clock in the morning. Just what you were talking about. Okay? We have serious problem with our families because of the environment in which they are living. And we will talk around and around and around this until we change the environments that people live in. We're going to have a very difficult time because we don't have community.
And for those of us that come from poorer communities and grew up with a bunch of not that educated people around us and somehow managed to escape, we know that that's not some sort of like, angel coming down from heaven saying, boom, there
That's
you
right.
go, you're off to an Ivy League college. That takes some luck and some hard work and some good people trying to get you a leg up, because the anger is real. The anger is real, and it takes a long time to get to the point where you can actually, I don't know, sort of digest it and rise above it, so to speak. But you know what? We got one
Poor
person.
people.
Sorry, go ahead.
It's just not poor, because I deal with all types of kids, because I dealt with a kid that lived in a $850,000 house, and his mother and father couldn't do nothing with him, and he did everything, every drug, every piece of violence he could find.
That's fair.
But it is the family. It is the family structure was broken.
Right.
And that's what causes our kids to. So it's just not poverty. It is just the structure of the environment, like Thornell said, what's coming in from the outside that's decaying our families.
Yeah. So before the men end up talking the whole time, I really want to hear from Kiana and Sharon on how they think. I'm not going to get tired of talking about it till it stops happening. The men in their life in particular, the boys in their life in particular, getting shot in the back, and it just keeps happening, and it won't stop. And where they, what are your feelings and what are your experiences around that concept? Kiana, why don't we start with you? Are you still there?
She's in the
Okay,
gym.
so we'll go. She just said in the chat she can't. Sharon?
I don't think that I can speak to this at all, to be honest. I'm probably the most privileged person here, just being a white woman, except for the woman part. But I will tell you, Mr. Watts or Pastor Watts or Reverend Watts, I'm not sure what the title was there. I know that our governor has been really focused on young men, and I was just wondering what you thought about that. I feel like his efforts are very worthwhile, and they're pretty spot on. And it seemed to be a large missing chunk of voters were discouraged men, white and black. But of course, black men are going to be even more, disproportionately impacted by all of this. So your thoughts on our governor on his efforts?
The other part of my thing, and I think Dr. Gomez, you might have came one time to the walks that we had in Brooklyn, and the governor came to several of the walks. So that is the misnomer that black men don't want to vote. And it's because of him coming out into the communities in Baltimore that got a lot of black men to vote.
Mm-hmm. Good. Yeah.
And being part of the process, I think,
yeah.
Even when I deal with young people, that's always going to be my lens. I'm always going to make my reference point from that, because if you don't make them included, they're not going to be included. Even when it comes to women's health, like the disparities of Black women dying at the hands of doctors, and not getting the treatment. But some, like my daughter, I have two daughters, two blessings, and having to be able to talk to them about how you feel, like being able to articulate when something is wrong. Having a sister that has medical problems and being able to go back and having us as a family, but if you're not made a part of the process, you will always be on the sideline and think that you're not included. So, but yes, he has, that's how I got involved and got some of the young men involved because of his
Mhm.
effort. And
I'm going to take the opportunity to say this is a perfect segue. We did a walk at Quiet Waters. I wanted to get things initiated on the idea of walking together, talking together, and showing by example. You do this for health, you do this for mental health as well as physical health. And I ran it by Reverend Watts, and we chatted briefly about doing a community hike in Brooklyn. And I'd like to bring that forward in the next few. So hopefully we'll be dealing with that. Another thing that we have as proposed events is a collaborative event with the NAMI, which is the National Alliance for Mental Health. And here in Anne Arundel County, I happen to make a connection with the executive director. They've invited me to be part of the board. And I think that these types of involvements are, are the way, as Reverend Watts points out, that's where the rubber hits the road. It seems like it's far away. It seems like it's esoteric, but it isn't. If you have a real experience with the governor coming out and like showing up, or elected officials coming out and showing up, then you understand there's a connection here. There's folks that might be representing my point of view and care enough to show up. So I encourage everybody to be a part of it and to spread the word and try to get more people involved, and to have these types of issues that we're discussing right now become part of a genuine, sustained discussion, not one-off. Because yeah, of course, we cite that there's a problem. Hopefully, the fact that this is recorded, other people might see it. We'll start the conversation. There's tons of people, there's tons of talent out there, and there's tons of legislators that care about these things. Not the least of which, Pena Melnick, who was with us not long ago, brought out all of the things that she's doing. We got to connect these dots and really lift up the people that are doing the work.
Can I just take 2 minutes here to talk about the past? Because I grew up at the end of World War II. I was a kid in the 40s, and we had community. You know why we had community? There was no TV yet. There was Walter Cronkite like on the radio, but we showed movies in the community. People put up a big sheet and they got a projector and they got a movie. The movies had news in the beginning, but that's not what got people out there. What got people out there was the subject of the movies. And I actually believe we had community because people got together to do things together. We don't do that in our communities now.
You know what? I love that idea. Could you shoot off an email to President Wadi and
Yes.
propose that concept? Because I think that would be a perfect opportunity to share good information. We might even do it up in a park over by Reverend Watts and bring out his congregation. I think that you're hitting on something very, very essential, which is to create community. You got to show up in groups and
we did it
Ellie-
all last year. We did it all last year in Brooklyn.
Oh, you do? Excellent,
So
man. You
we
got to
do it.
invite us.
We need to do that in every community on Forest Drive. They're all isolated, and if nothing new comes into the community, what's going to happen in the communities? They will continue to die. I mean, the people dying. I'm not talking about the community disappearing. It's not going to disappear, but the life that those people have has no inspiration. I'm looking at kids going into 7th and 8th grade, and they're talking about, I want to be in the NFL. Come on, man. How many people are in the NFL? Less than 600. And every kid wants to be in the NFL.
Yeah. Yeah.
And I wish it were only the one population. We're talking about all kids. So unfortunately, the reality there, they missed that. And of note, when Reverend Watts and I visited the school with the kids that he's dealing with. The connection that we made wasn't around sports; it was actually around music. Any which way you can get there, so long as they get some kind of anchor that can identify with folks that are involved. Obviously, the folks on this call are all great examples of folks that are productive in their respective areas, and I think all of us would be folks to model for young kids especially. We're running out of time, so I don't want to keep us beyond the time, but let's take the opportunity. Each of us had something of significant value to contribute to the conversation. If you could form it into an email and direct it to President Waddy at NAACP, it would be invaluable to help further the not just the discussion, but actually create actionable items to bring this forward. All right.
All right.
Can I say just one quick thing is, and tell me if I'm wrong, but my hunch is that our governor, back to the governor a bit, has been really mentoring Brandon Scott, the mayor of Baltimore City. And I think it's been nothing short of miraculous what's happened in Baltimore City. To be frank, I consider Baltimore County worse place to live than Baltimore City, given everything they've gone through the past 2 weeks. But sorry, I said what I said.
Hey, think half full, not half empty.
Jesus, I mean, it's just Baltimore County is just a corrupt crap show.
Let me tell you, if it were only Baltimore County, I think the bigger problem that we face isn't just corruption, but just an empowerment of hate that is a push that is a anti-progress, anti-people, anti-ethics. So again, I think all of these are positive ideas and thoughts. If we could, bring them forward so that we can, create.
Who's in Baltimore County right now? Who lives there?
Sorry.
Oh, hi. I didn't know you were on here. Oh, okay. Hi there. Do you live in there? No, you live in, you're just there right now. Got it. Okay. Yeah, I'm sure you've been watching this, but I was just wondering, I mean, I am such a fan of Brandon Scott. I got to tell you, and it's just been really cool just to see kind of his growth and evolvement the past several years, and to see Baltimore City turn around and have some of the lowest violence rates. Oh my gosh, since I've lived in Maryland, probably. And I think that really goes to that mentoring. And I think it goes to our governor really reaching out and working with them. That's just my personal opinion from a bystander, but I hope I'm right, because it's been really, really marvelous to watch.
No,
I'm going to close on this. I think that, President Waddy just pointed out in the chat that, NAACP co-hosted a film screening at Harvest Church. To be honest with you, this is the kind of thing that makes it a huge challenge, right? Because our penetration and our presence in the media is not what it should be. I think it's because we need some more young people up in here doing some Instagramming and whatever the heck they can do to communicate. Because when they get their word out, it gets out there. And when we do it, it's kind of more like a turtle pace. So let's see what we can do about, if anybody has any connections with young folks that might be able to contribute, please inspire them to join, to be a part, and to bring their ideas. And with that, I think we're going to close up. I'm going to have you all back again, I think. But I think we're going to close up now and let folks get back to their lives. Thank you so much for sharing all of this stuff. It is absolutely great to have this brain trust of friends doing the right thing and doing the work as you have for, I think I've known some of you like a decade and a half now. So thank you for being on the call, and we'll talk soon. All right.
Thornell, good to see you again, sir. Always good to see your kind face. And Ellie and Stephen, I'm going to get in touch with you this week. I saw your emblem, but it didn't catch me that you were on. So wish we could have visited more. And Ellie, I hope you have a great week.
Thank you. Take care.
Bye, y'all.
Bye-bye, Kiana.
Take care now.